Hello and welcome to my channel. My name is Colleen and I'm a registered social worker and mental health therapist. Today's video will explore cognitive processing therapy, also known as CPT. CPT is a highly respected, evidence-based approach that helps individuals heal from trauma. Whether you're curious about how it works, considering CPT for yourself, or supporting someone who is, this video will give you a clear overview. Let's get started. In this video, I will explain what CPT is and describe its primary goal, how it works, and its key components. I will also look at what the CPT journey typically looks like, its outcomes, and who may benefit from CPT therapy. I will close with some of the common myths about CPT and a discussion of the advantages and disadvantages. My goal is to provide you with a basic understanding of CPT so that you can make an informed decision about whether or not CPT may be a good choice for you. CPT is a structured short-term therapy designed to help individuals who are experiencing PTSD or trauma-related distress. At its heart, CPT helps individuals explore the beliefs they formed after the trauma, especially the ones that feel painful, rigid, or overwhelming. It was developed by Dr. Patricia Rezic and is backed by decades of research. Think of it as a roadmap for understanding how trauma has shaped your thinking and a guide toward how to gently shift those thoughts towards healing. The main goal of CPT is to help individuals understand how trauma has shaped the way they see themselves, others, and the world. Trauma often creates beliefs that feel absolute. For example, believing it was all my fault or I'm never safe. CPT helps individuals slow down, explore these thoughts with curiosity, and learn new ways of evaluating them. The aim isn't force positivity, it's clarity, balance, and self-compassion. CPT has four main components. First, the individual learns about how trauma affects their thoughts and emotions. Second, they identify the specific beliefs that keep them trapped. These are called stuck points. Third, they learn skills to challenge and gently question those beliefs. And finally, they do structured reflection and writing exercise with the support of a therapist. Together, these steps create a powerful pathway toward healing. Trauma can deeply affect the beliefs we hold about ourselves, others, and the world, especially in areas like safety, trust, power and control, self-esteem, and intimacy. These shifts are completely normal response to overwhelming experiences. In CPT, the individual learns to explore how their beliefs may have changed since the trauma and how those changes might be influencing their life today. This understanding becomes the foundation for healing. Stuck points are those painful, rigid beliefs that make the individual feel trapped in one place and unable to move forward. They often sound like, "It was all my fault," or "I can never trust anyone again." These thoughts aren't chosen. They're formed in the aftermath of the trauma and as the mind tries to make sense of what happened. In CPT, the individual learns to identify these patterns so they can begin to gently question them rather than letting them control the narrative. Once the individual identifies a stuck point, CPT teaches them how to look at it from different angles. They explore the evidence for and against it, consider alternative perspectives, and learn to separate facts from assumptions. This isn't about dismissing feelings, it's about expanding understanding. Over time, this practice helps replace harsh, self-blaming beliefs with more balanced and compassionate ones. CPT includes guided writing exercises that help the individual reflect on how the trauma has influenced their beliefs. These exercises are always done with the support of a trained therapist, and they're designed to help the individual gain clarity and insight. Many individuals find that writing gives them space to process their experience safely and thoughtfully. CPT focuses on 5 important life themes: safety, trust, power and control, esteem, and intimacy. Trauma can shake our beliefs in each of these areas, sometimes without us even realizing it. As the individual moves through CPT, they explore each theme to understand how it may have been affected and how they can rebuild a more grounded and flexible sense of self in each area. The typical CTP journey lasts about 12 sessions, but is sometimes extended if additional time is needed. Sessions are usually weekly or bi-weekly, and each one builds on the last. Keeping sessions closely scheduled is important to maintain the flow of the therapy and increase efficacy. Individuals explore new skills, reflect on insights, and work collaboratively with the therapist. Many individuals describe CPT as structured but supportive, a balance of learning and self-understanding. The therapist will tailor the process based on individual needs, ensuring a comfortable pace for the client. Individuals who complete CPT often describe feeling lighter and more in control of their lives. Many experience a significant reduction in PTSD symptoms, improved self-compassion, and greater mental clarity. Over time, the skills learned in CPT can strengthen relationships and increase emotional resilience. While healing looks different for everyone, CPT offers a roadmap that helps many individuals move towards stability, confidence, and hope. CPT may be helpful for individuals who are experiencing trauma-related symptoms, PTSD, or ongoing distress connected to past experiences. It's also helpful for those who feel stuck in patterns of self-blame or overwhelming beliefs. Because CPT is structured and skills-based, it can be especially grounding for individuals who appreciate clear guidance and practical tools. A trained clinician can help determine if CPT is the right fit for you. There are few common myths about CPT. One is the belief that the individual will have to relive the trauma in detail. This is not true. CPT focuses on beliefs and not retelling the event. Another myth is that CPT is just positive thinking. In reality, it's grounded in examining evidence and structured reasoning. And finally, the belief that if healing doesn't happen quickly, then it's not working. Well, some weeks will feel easier than others, but every step counts, and gradual progress is both normal and expected. There are numerous advantages and disadvantages of CPT. In terms of advantages, CPT is an evidence-based, effective therapy. It can help individuals with all types of trauma, including those who suffer complex or developmental trauma. It is ideal for individuals who desire a structured approach that is predictable and consistent. In terms of disadvantages, CPT requires a 12-session time commitment and is generally considered an intensive therapy as sessions are scheduled on a weekly or biweekly basis. CPT also requires a considerable time commitment as homework is assigned each session, and because each session builds on the next, homework completion is crucial. If you're considering CPT, a helpful first step is connecting with a trauma-informed clinician. You can look for therapists who list CPT among their specialties or search reputable mental health directories. It's okay to ask potential providers about their experience with CPT and how they incorporate it into their work. Finding someone who feels like a good fit is an important part of the therapeutic process. CPT is an effective, research-based, and trauma-informed approach that can effectively help individuals who suffer from PTSD, including developmental PTSD. CPT offers a compassionate and structured way to understand how trauma impacts an individual's beliefs and how those beliefs can change with time and support. Healing is possible, and learning about these tools is a powerful step forward. Thank you for watching. If you'd like to learn more about me or my practice, visit turneyandwellness.ca. If you enjoyed this video, please subscribe, like, comment, share. Thanks again.